So we'll start off with the webinar, and we'll start with the first presentation for today, that is addressing mental health concerns during pandemic and its aftermath by Dr.S.K. Chaturvedi, Senior Professor of Psychiatry.
Good afternoon and welcome to all the people who have joined online. And I would second what the director has told about the role of media, and especially in the pandemic times, it has been really very, very positive. And that I think even the media would think it is very commendable, because many times media is at the receiving end of the public in being criticized about them. But I think the role of media is very important. When we had actually planned this program, it was more about media and mental health only. And it was to, because in the mental health education, we had a lot of contact with the professionals from media, and they wanted to have some information about mental health. Whereas we as professionals in the field of mental health wanted to know how to interact with media, how to report to media, how to answer their questions, how to be able to give appropriate information, how to give a very balanced type of a picture. And there is obviously two ends of the balance are, as mental health professionals, we like to be very balanced and scientific. Media, of course, the job of media is to be heard, to be read, to be watched. So these are the three goals that I have with my little understanding about media. So if you have to, if a media has to get attraction, then of course they need to put some sensational news, make it sound that it is something readable, something watchable, something which would attract the interest of public. I'm not even talking about the commercial part. I know there is a big commercial part of media also, but that is their job, and of course you cannot remove it. So when we planned the program, we wanted to have an interaction between media and mental health, and learn from media what do they expect from mental health professionals, and how we should be able to do that, and also inform them partly about mental health, which is the common concepts of mental health. And but the scenario changed in the last 3 months because of the COVID-19 pandemic, and it has brought about a rapid revolution in what the media presents and what the media expects and what the mental health professionals are facing. So I've had the opportunity to be on some of the Doordarshan programs, Rajya Sabha TV program, Mirror Now, various other news channels. There is one tomorrow morning also in the program Healthy India on Doordarshan, and it's very interesting. I think I'll just talk about the print media and the audiovisual media. I don't know what you call it, like the television media, and also a bit about the social media. So the programs are so well organized. Most of the programs are phone-in programs, which I think is something very relevant. And even today, when we are having this, we have kept ample time for people to ask their questions. You might not be able to phone in because there are more than 100 participants, and it might be difficult to listen to all of you. But you can put your queries in the chat box, and if there is anything that we know, that we can respond to that. Otherwise, we can put you on to the concerned experts. So one of the observations which I have made in media, and I would like to repeat it now, is that the amount of health education which has been provided by the media in the last 3.5 months is enormous. It is enormous to the extent that, I don't want to be critical, but in terms of This amount of health education I have not seen in the last 30, 40 years. Maybe during the time of HIV, there were lots of media attention to that, but it was not to this extent. Various other infections like SARS and MERS and cholera, so they've been very, very short, and there have been some attention to that. But this has been amazing. This is like one course of MBBS and nursing to the whole country. Everybody has learned so much about health and about hygiene, whether it is physical hygiene or respiratory hygiene, and not only about physical health but also about the mental health. And I know people are looking at what are the treatment options, when will the vaccine come, and many things like those. So that is the first test, that the media has actually educated the public. Simultaneously, the media has not only media, the COVID-19 and media have educated the government, the officials. I have never seen so much attention of the government, the ministers, and up to the Prime Minister on health issues so very passionately and so very worriedly, concernedly. It is amazing. And of course, it cannot be all which they have got directly because of the lockdown and pandemic. During the pandemic, there is no other way to connect with the world other than the media. So we listen to the media, we learn from the media about what is going on in various countries, and what are the options about about the treatment and various things. So education has been one of the main contributions from media to the public, to the society, to the government. But like anything else, there is a term coined by someone, I don't know who, but it's very right. This is the infodemic. There is so much of information. There is an infodemic of information. It's a pandemic of information. It is just too much. It is so too much that, personally I can say that, I have stopped listening to news. And in newspapers, I have to search for, where is there, something else. I got the impression that nothing else is happening in the world other than, coronavirus. Maybe nothing else is happening, but I really don't believe it. But there are lots of things which are happening. So I don't know what happened to the rest of the news. And rest of the programs, rest of the things. I mean, it became too much. And that is one of the reasons, because when we did the foreign programs, on one hand, people would ask how to cope with the infection and to how to cope with the problems related to that. On the other hand, they would ask how to cope with the abundance of information. And in one of the meetings, I have said, and I would like to say it now, I think there should be a lockdown on media. You might not like me for that, but when I say lockdown, I think it should be very limited. I mean, every day, there is not so much happening at that rapid phase. I know there is a competition in vaccines, and there are various treatments which are coming in. In each news, maybe they should have not more than 2 or 3 minutes in the half an hour to talk about, COVID-19 or coronavirus and all that. And same way, newspapers should have a limitation that, you will not have more than these many columns, so that people, because that is very important for the mental health of the public. Because when people read more and more, that increases their worries and concerns, and many of them are unfounded. People who are already worriers, they are even worrying more. There is a fear which is, being increased. On one hand, media points out where there is stigma, so that people should not have stigma. But on the other hand, when they hear stories about stigma, the stigma itself increases. So there has to be some sort of a balanced, reporting by the media, and it should be in consonance with what is happening in the world. I know the role of media is, if they look for something, they will find something. There are lots of things which are happening. In the last maybe 1 or 2 months, only respite we have got is when this Vikas Dubey incident happened. and then media rushed to that, and we heard very little about Corona, and we heard a lot about Vikas Dubey. Then there was some political upheavals here and there, which will take away the things. Then a few days back, suddenly Amitabh Bachchan and his family had this. The whole day was news about Amitabh Bachchan. Though it was also related to COVID, but they were playing his old songs and old many things. So it was a very refreshing break. So other than that, it has actually caused a lot of distress to a lot of people. Coming to social media, I think the role of social media for people who use social media has been, really very, very amazing, and it's been an eye opener. You get the latest information. The advantage of Twitter is that it has only our 140 characters. You can't have more than that. But LinkedIn is another one which is providing a lot of information about developments. People are sharing articles which are being published and things which are happening. Facebook is giving people an outlet for the type of experiences that they are having. So there are a lot of things. Besides the formal media, there is also the informal media where there are videos of people putting up on YouTube. So and they are making their own videos and putting. A lot of them are very educative. A lot of them are webinars. And I think if we are able to make one capsule out of this, we'll also put this on the YouTube for people who have missed out, where they can see. There are a lot of things on comedies and humor, whether it is on Corona or whether it is on anything else, which is another respite to that. So I hope that better sense will prevail, and that there should be a balance of things. One more important thing I would like to mention is about media professionals themselves. And I think they are going through a lot of stress, because at the rapid rate at which information is generated, and I know that they feel it is their responsibility to share this. Not only that, but all of them are very human. So they also are aware of the risks that they have to face when they go out in the field. And my understanding is that the role of media is also considered as an emergency service, so that they are allowed to go out, despite the lockdown, and find out what is happening. Media points out a lot of things which people are not able to understand at times, and then that makes institutions and organizations to stand up on their feet and be able to meet up to that. But I think there's a lot of stress in the media and the media professionals. I don't want to name, but I have had queries from people working in newspapers and media about their own mental health and COVID related. I'm not talking about otherwise, but they are wondering whether they are putting themselves at excess risks. And when they have to, because they have to go in this field, they have to interact with the society. They are not able to know. Of course, now that our understanding was that people who are symptomatic are probably a source of infection. Now we know that people who are asymptomatic are also source for infection. You don't know that whether the person is positive, whether the person has virus, whether the person can transmit virus or not. So they are under a lot of stress. And they've been seeking help from us and from my colleagues about what to do, how to cope with it. We still don't want to go into pharmacology. We are still going by allowing not only public and media people how to reduce their tension, how to reduce their stress by the common methods which are possible within the four confines of the home, which is do yoga, meditation, various whatever recreational activities. I know it is very difficult. Ever since work has gone to home, school has gone to home, gym has gone to home, everything is in home. And in all this, the home is lost. Where is home? When people used to say, I'm going from work to home. Now you are going from one chair to another chair. In one chair you were sitting and working. Now in another chair you're sitting and having your meals. So the whole concept of home has changed, and that is causing a lot of stress. So, with these words, I would, thank you all for listening to me. We look forward to your ideas and suggestions, how we can help as mental health professionals, and how media can help in this venture about how we can help our public and all. And thank you very much.